Thanks, Mark, for this beautiful presentation. You gave us also some not usual insights, for example, those ones concerning to the access to the urban green areas, which is maybe something not so perceived in terms of how many lives these simple, or let's say in some areas not simple, public health measure could generate, could produce. Thanks a lot for this global vision on the urban mobility. We see that the capital of Italy is at the bottom of your classification of the European cities which spend their investments in bicycling and in urban mobility, in green urban mobility. This is a pity. Of course, our cities could benefit from this new model that you have proposed with these new blocks compared to the current situation. This could also be another measure of a simple policy, urban policy, to be implemented if just the policymakers at urban level, at least in the big cities, could adopt it. I think that with the Italian Society of Environmental Medicine, we can make these kind of proposals to the mayors in Italy, as the Italian situation is the worst one. We will get your scientific advising on this topic to get to this purpose, because it is unacceptable that this country could be at the bottom of investment in these areas. At the same time, also our delegation in Spain would cooperate with these ideas that are very interesting. Those ones you have just presented. I would like to know what Carlos Dora thinks about. Carlos, are you there in Catania in presence?
Hi, Briscoe. I'm Carlos Dora, president of the International Society of Urban Health. I'm very pleased to be here, and very pleased to have come to Catania, because I could yesterday, just by walking around, see the beauty of Catania, the great architectural and historical assets that Catania has. The fact that it's near the sea, although you cannot really connect with the sea very much yet, but I think it makes a very big difference. I was thanking Margarita and telling her that it makes a big difference to see the place and to feel the place and to see the people and that's what my brief talk is going to be about. We're very happy, and I just put out in the screen when you think public policy or policy making in public health, there's a few elements. So in any situation, you would be thinking of those. You're thinking of the contents of the policies, which is basically what we had the fortune to have Mark Neuenhausen and Prisco Piccitelli, and before the person from the Ministry of Agriculture, talking about what are the policies that work for health. And people here in the morning were presenting. So the what, we're very fortunate, and I'm an environmental epidemiologist, and I think we have done great strides in environmental epidemiology, including, and then we now have a lot of evidence, such as the ones which are being summarized by Mark, in the ones that we summarized when I was still at the World Health Organization. I worked years on energy and health, or housing and health, transport and health. So I think that knowledge is still growing. There's a lot of recent developments, but I think we're very solid there. And if you compare, when I started working on transport and health in Europe in the 1990s, I was based at the European Center for Environmental Health in Rome. It was a WHO office in Rome, nobody believed that cycling was a means of transport or that walking. It was a very, it was very difficult to overcome that first hurdle. And we now all agreed that, cycling is great and, it is part and parcel of developing a healthy urban future. So I think what I'd like to stress is that I think we're well informed by the efficacy of many of those policies. And we do have health impact assessments and health impact scenarios that we're able to do. And there's a lot of good work on that. And I've been personally very involved in that for a number of years. But in order to have that implemented, which is the question where Mark left, he stopped that, well, yes, and then we need, other people, we need cooperation. But that's generally left vague and is still work to be done. And I do think that we, in a way, suffer from our basis, which is very Cartesian and quantified, and it's hard science, right? What most of us have been working on, both in medicine and public health and environmental health. And what I think where we need to go is to understand how is it that then those policies can be applied. And I think a specific place and a specific context is very important. So within the policy scenario, the context is very key. And we are again very fortunate. This morning that the Minister of Health person was saying that there's this new European Union funds for reconstruction that are now going to be used by the regions for a number of those environmental health policies that are good for health and the environment. So I think that's very fortunate. And experience from elsewhere, we see that the political context, like during Trump administration, which was completely climate skeptic in the US, there were enormous progress led by the cities in California, for example. So we see that the city doesn't necessarily have to run at the same pace as the national government. It's normally useful to have that, but it's not essential. And there's a lot of leeway and space for people in a specific place to take action and to create transformations. The kinds of transformations that also Maria Nader was talking this morning. It's clean energy, it's access to sustainable food systems, and it's good urban planning. That's what she was raising. So understanding that context and the opportunities that the context brings, I think is important. But what actually makes the change and what the actual knowledge that I think we need to have, and in the society we're going that direction, is to add the information in the policy process. And how is it that you can create agendas or make issues to raise up in the agenda, or to create institutions or capacity that lead to those transformations. So, for that, you need people. We need actors, and I think the university is a key actor, the municipal authorities are key actors, and civil society at the local level as well, as individual activists or leaders. So I'll close the circle saying that for us in the society, and we just to say a couple of words about Society for Urban Health, we used to be based in New York, Academy of Medicine, and a global society, but very much them focusing on members which were academics, which are still there. But the transformation that we're going through at the moment is to actually engage with more people who are in civil society work, in local governments. So we can add, in addition to the knowledge part, we can add the practice and the engagement at the local level actors. So I see, and for me, I'm very happy that I can see a lot of opportunity in Catania, for example, in terms of what could be done, just by having the sea next door, just by the knowledge that we have, just by seeing that your real estate, the buildings will probably benefit, they can benefit from these investments in energy efficiency. So you could do that with the mind that, how is it that we construct better health for the population here and for the visitors. and maybe can attract more visitors and can get access to the sea, etc. So we can see the opportunities, but the question is, and maybe the opportunity is how to make those links and to create initiatives and to create partnerships that allow that to happen. So thank you for the opportunity to come here. I'm very happy that the society, Italian Society for Environmental Medicine is present. I've been collaborating with the society for a number of years. And I'd like to say that for all of us, WHO, Italian Society for Environment, for ISUH, International Society for Urban Health, we will all be very supportive and interested in learning with Catania, for example, and Sicily and other regions in Italy, of how we can use, maybe we can inform and help, but how we can use these opportunities to build the kinds of policies that we know are good for public health. So I thank you for the chance to be here with you, and I look forward to the next stage of this conversation. Thank you.
Thanks a lot, Carlos. I think that this commitment of the Italian government to spend some of the recovery fund on environmental health projects through the commitment of at least 3 regions on specific projects could be something that we can even take advantage for presenting a project on the theme of urban health, as you were proposing. So we will monitor as SEMA very closely these calls that are forthcoming. I think that now is the time to switch to the poster sessions, which highlight one of the components of health risks of our cities, because we are generating a lot of pollutants in our cities, which are also recognized as carcinogens of first class by the International Agency for Cancer Research, the IARC from Lyon. So some of this presentation will very interestingly address this theme, but I leave the floor to Domenico and to Dr. Fernandez.
Thank you very much for your comments. I think these presentations were definitely very helpful. I think that we can definitely learn from European cities. The density of these cities is what makes these cities great and walkable and sustainable. Coming from the US, specifically San Diego, California, I can say that I want to go back to Mark's question in the beginning of his presentation, where he talks about how to make cities healthier. So when we think about how to make cities more healthier, I would say the inclusivity of the city. We can see that across the US, cities are built for cars, not for people. And this is very unfortunate to say, but in addition to that, we also see that specific cities within that have higher incomes have more access to bike lanes and transportation infrastructure, and that leaves people behind. So how to make cities more inclusive? This is something that we need to ask ourselves, how also to learn from European cities when designing new cities that are, let's say, much more higher in density. And also I wanna just bring a point that was mentioned in one of the speeches about integrating greenery within the city. I think in terms of creating a balance between man and nature, it's definitely a necessity within our cities. However, would you consider a city that has a lot of greenery and needs a lot of water consumption sustainable? So these are questions that we need to definitely ask ourselves. Coming up with water sustainable infrastructures can definitely be a solution. In the past, I've worked on, let's say, fog harvesting technologies using an unexplored, let's say, water resource from fog and humidity, and using this as a way to water our, let's say, plants within our urban environment. So that could definitely be a solution for this water consumption issue. But another issue that I find in the US concerning this lack of bicycling, lack of walkability, is the fact that cities are not very walkable. And as a result, people have no choice but to ride their vehicles. They don't have access to healthy foods, and they also have to always be dependent of their vehicles. Also, I've seen that a lot of, let's say, poor neighborhoods within the US have higher number of bicycle deaths. So a lot of people don't have access to a vehicle, and as a result don't have the proper infrastructure for that. So when we think about how to make cities healthier, how can we make our cities more inclusive? I believe that is our question. How can we distribute resources across our cities in a equal manner? So I don't know if perhaps Carlos, Dora, you have a comment on that.
Certainly. I think we agree with all those points. And I wouldn't say, I think Mark showed well that Europe is also a very varied and diverse place. And there's places like Utrecht, the picture he showed. So I think I would agree, but I will still go back to the point of how is it that we create change in one of the elements that we need to create that change. And I'll bring one example that I don't know how many of you have seen. There's a fellow in Germany who does these little videos. He's an art designer, and he makes videos of transformations of streets. And he takes a specific place, and I can give you I'll give the name to you. It's worthwhile because you can, in less than a minute, see what would happen in that street if you, instead of cars, you would have trees, if you have people, you have. So I think those gimmicks or those gadgets are important for the change-making process, because it's not only the rational knowledge that we know and that we've seen that there's more health benefits coming from. There's also, first there's a very important input to that transformation. But how do you change perceptions? How do you change aspirations? How do you change priorities? So I think those elements we will benefit from having more of that in our context. And I think the fact that we tend to mix more between people who are natural scientists, and I count myself, I'm a doctor, I'm an epidemiologist, and I like numbers. I count myself amongst those. How is it that we can learn more from people who are working on the policy transformation environment, who are anthropologists, who are policy people? So I think that interface is probably what we see in this, myself and in the society, is the next challenge. I'll just give you a small example with equity. We're doing a project, a global project, where we're documenting how people manage to bring health equity in the city. And that's in all regions, in all languages. So we're translating the results into English. But the beauty of the project is to focus on how are people making change and how they manage to make change, to bring health equity in a city, in different places. And we're coming up with, or they are coming up with, many interesting stories. And the way that we're capturing that, it also has to be creative, because people like to hear stories. They have to be scientifically sound, but they also have to talk about this or the process. How does it all happen? What were the constituents of the policymaking environment? So the project is still going on. We have a conference now in the end of October where some of this will be discussed. But having a way of telling stories, of doing the analysis of the process, policy process, I think is part of where we should be going in environmental health to get to the transformations that you want to do in San Diego. I know San Diego, and I think I agree with you. There's still, comparatively with Europe, you're further behind in terms of occupying car space or occupying everywhere. But I do think it's a global issue And I do think that the kinds of cooperation that we could build, I think would be very helpful to get that a next stage to the transformation that we need.
Thank you. No, I definitely believe that we can learn from European cities. I feel that the inclusivity issue is still something that we have to deal with, that different areas within cities do not have access to, let's say, appropriate infrastructure. Well, that's leaving people behind. But perhaps, as mentioned by the speaker, that it's all about storytelling, and perhaps creating signage to meet different needs of people can definitely be a starting point, making sure we consider everyone. Thank you.